Hi, welcome to Carolina Breast Chin's YouTube channel. Welcome to today's Zoom on breast and lymphatic health. I'd like to introduce Claire Jelnicki. She is a registered nurse in North Carolina. She is currently focused in proactively improving breast and lymphatic health in her patients. She is a breast cancer survivor herself and understands the importance of lymphatic treatment and therapy. And with that, I'd like to turn it over to Claire.
Hi, everyone. I am Claire, and thank you for having me today. I'm very appreciative of being here. I certainly understand the concerns and the need for lymphatic health and how important it is. Today, what I try to do is, just try to share what's happened with me. I was diagnosed in 2018 with invasive ductal cancer and of my left breast. And I ended up having a lumpectomy, radiation. They took out 5 nodes. We did the oncotyping, everything else. But after the radiation, within 2 months, I developed lymphedema on my left breast and my left arm. I started with it over like a period of a couple of days. I gained so much weight and needed to have it addressed. And that's how I was introduced to this world of lymphatic health. Yeah, I know my background's in nursing, and I did that for many years and worked in intensive care. But until you go through something, you just don't know it. And I think my mantra is really that I praise God above and thank him for my healing and want to share it. And I can't help but talk about my experiences and how important this lymphatic work is for everyone. So with that, let's go ahead and get started. Just to keep in mind, my goal, our primary goal at this in the practice is really geared toward education, prevention, treatment of breast and overall lymphatic health practices. Okay. So we'll get started. I don't know where everybody's at in their journey, but I just want to talk a little bit about the lymphatic system. Okay. I mean, that's what we're here today. So let's get a little better understanding of what it is. Your lymphatic system is pretty much your immune system. So when you have any kind of bad cells or when you cut yourself or anything like that, the immune system takes over. And the lymphatic system is really what moves all of those good little cells to help heal. Okay, so that's what we're doing. But when I have clients come in, the first thing I want to talk to them is about what's going on with the lymphatic system. The lymphatic system is a very it kind of runs along the same along with your circulatory system. So, but it's very small tubules. It's just underneath the skin surface. So if I just touch my hand just ever so slightly and very lightly, I can move the lymphatic system and move that fluid. So, but there are a couple of things that are really important in understanding what's going on with the how the lymphatic system flows. So direction and flow is very important. We have to understand where all those nodes are. When you have surgery, they may take a lot of the nodes out from underneath the axillary area to test them. Okay, and if they're removed, there's a compromise to the lymphatic system, and that's what causes some of that backflow that you might see where we have what's called lymphedema. And so those nodal collection areas are here in the neck and the throat area and underneath the arms. Those are just two areas, but they're all in the groin, throughout the body. We have about 700 or 800 nodes throughout our body. And that to me is so key to our immune system. That's where I call it the washing machine of the body because that's where everything gets broken down to get smaller and smaller so it can get cleansed it throughout the system. Okay. The flow is very important, and the direction of how it flows. So when we get surgery to our breast, I know I mean, I had some disruption with it from the bad cells that I had because of the surgery, but everything flows from the waist up toward the underarm and then to the neck. Okay. So when clients come to see me, I teach them techniques that are going to help improve that flow. Okay. So if somebody presents with a mastectomy or a lumpectomy, or if they've had radiation, or lymphedema, and even scar tissue, I work with them to clear that out, and just reduce the swelling that comes along with it. Now, if you're actively on chemotherapy, that's a little different. It's not that you can't do lymphatic work, because when you're breathing, you're doing lymphatic work, right? The doctor tells us to breathe deep, take deep breath, and even exercise, right? So we are impacting our lymphatic system no matter what we do. But if you have chemo, that's a little different story. We want to just ease back on it, especially in between, while you're getting infusion. Okay, but it doesn't mean that you can't have it done during the process. But usually, while you're being infused, you can't have it. Now, the other thing with radiation, while you're actively having radiation, you don't want to do excessive lymphatic work either, because you want that targeted radiation to do what it's supposed to be doing. So that's important. Um, Let's move on. Here, I just want to show you, this is just a wonderful graphic that we've come across that really shows you how tiny the lymphatic system is, the tubules, and how they all run in the whole breast and upper chest area. So the blue is the veins, the red are the arteries, right? The arteries take this circulate blood to the cells. And then at a capillary level, at a very teeny tiny capillaries, that's where there's a mix of the nutrients. So the cells use the nutrients, then they send it off and put back into the venous system. And then it goes back to your kidneys and your to get and liver to get processed and released. Now, that's all fine, but the lymphatic tubules that are really tiny on the orange or yellow, those are tiny, tiny tubules, no bigger than a hair strand. Okay, so that's why it's very important to move it slowly, because it has to go slowly through the system. And lymphatic drainage itself, that therapy is a very slow, gentle, soft motion. So everything flows away from so if you look at this picture with the breast, the lymphatic system, let's take it one step back. The milk ducts flow away and toward the nipple. Now, in the lymphatic system, it flows in the opposite direction. So it flows away from the nipple and the areola and toward the underarms. And that's how it gets processed through toward the heart to get processed and broken down. Okay, so it takes all of the proteins or toxins that have been released by the tissues, and especially when you have, surgery or radiation, because it definitely affects the tissues. Okay, the tissue in your system, and the bad cells have to go somewhere, and the broken down particles have to go somewhere, and that's how it gets processed through the lymphatic system. Think of when we do a lymphatic breast massage, it's very different than regular breast massage too. It's not firm, it's not hard, it's very soft. And you can think of your breast as a sponge. Your breast tissue collects stuff, hormones, toxins, and it has to go somewhere. So if you had a dried sponge and it had dry syrup on it, how would you clean it, right? You would have to rinse it with water and then squeeze it. So the other important piece of your lymphatic health is drinking lots of water. All right. So if you think of it as a sponge, you run the water, you're drinking water, and then you're gently moving it and squeezing it. Okay. And that's part of what we teach women to do in their breast health care. Now, and we love prevention, but we are, we love working with women who have had some compromise as well. So, and I know I'm hoping I'm explaining this a little bit better to you, but if you have any other questions later on, I'll be happy to take them. And moving along, we teach what a lymphatic clearing. Okay. So what that is we call it MLD 1, 2, 3. We have different positions. Okay. So we're clearing closest to the heart to start moving any kind of broken down like proteins or hormones. We want to get them out of the system. So we would clear closest to the heart. It's like clearing out a funnel. If you have a funnel with, and you're trying to bring the water through the funnel, if you don't clear the small piece first, none of the water in the funnel is going to go through, right? So we want to get that out. So we would clear closest to the heart here. And I use a gentle stroke here to do that lymphatic clearing. So it would just be from the shoulder, the top of the shoulder toward the sternum. And then the second piece is right here from the underarm, in front of the underarm, up to the clavicle, and then underneath the armpit, okay? And I would hold gently and then just bring it out over here and then clear it. So you do that on both sides. And then what we'll do is teach a breast massage. And the breast massage is really cool too. And I hate calling it massage because it's just really, truly therapy. We also use a little wave-like motions. So I mix it up. We do some wave-like motions. Sometimes we can do some just a little bit of pressure tapping here. And that's always good to get the nodes moving, especially if you like wake up in the morning and you feel like you're really tight or something. Just do a little pressure. You can do that, a little tapping, clearing. All of those things are so good. And there's so many different ways to do it. And when you find your own way to do it, it just makes things a little bit easier. You'll get some relief and you'll get it quickly too. As long as you're drinking plenty of water and doing this massage. All right. So let's talk a little bit about how do we optimize our lymphatic system. Our lymphatic system, there's so much we can do on a maintenance level and prevention. Water, hydration is pretty much key, okay? Hydration, it will help to regulate our temperature. It improves the kidney function. It filters out those toxins that are in the bloodstream that we want to get rid of. It also improves digestion. It helps to prevent constipation, carries nutrients, and it detoxifies the body systems. Okay. Nutrition is another key factor. When I know, I'm sure you've heard, getting to a clean diet, no pesticides. It's so important. When I was diagnosed, I was going through the health coach certification program. And if it wasn't for understanding what was happening in my body itself, I don't know if I could have done this as successfully as I did, but I I was able to that was the first thing I did when when I was diagnosed. I did my nutrition. I really honed in on that. What could I do to make myself healthy that way, right? So my anchor, my thought was, I don't want to go through this again. So I changed my diet completely. I started eating organic as much as possible. I took out, most of the gluten, most of the pasta, all of those the foods with sulfate things in it, sulfur, just the pesticides, the processed foods. I thought, eating turkey sandwiches for lunch was like the greatest thing I could do for myself. But what I didn't realize was all the problems with processed foods, all the stuff. So when you're reading labels, it's not just about the calories, it's about the stuff. My rule is I prefer to eat something that has 5 ingredients or less. That was really helpful to me. Um, some other things you want to make sure is that you're not eating those processed, those GMO foods. You want non-GMO. You want stuff that's not going to have junk in it. And to me, it's just, garbage foods. Stay away from your fast foods. Um, really, really hone in on anything that reduces inflammation. Okay. So when we eat foods or we're doing activities that increase that inflammation in our system, it makes the body and the lymphatic system have to work harder. So let's try to make it work more effectively. We don't mind it working hard, but we want it to work effectively. So that's where our exercise comes in too. Yoga is phenomenal. The restorative yoga, yin yoga, is really good too to help move the lymphatic system. Holding those poses for like 4 to 5 minutes will really help open up the system. And I found that to be very helpful too, in the early stages. What else? The There's some other things you can do. Monitor your environment. We've got our phones right next to us. And when we put it near our face, near our heads, our heart, sometimes we put it in the sleeve uh, underneath our sports bar when we're running or walking. And that is just not a good place for it. You want to keep it away from your heart, away from your breast, and away from your head. That EMF stuff can really do uh, some impact on what's going on with our health. Uh, Looking at your makeup, looking at your shampoos, switch to products that are just as organic as possible and free of those um, parabens and sulfates. Moving around. The other thing is, I'll just briefly talk about is emotional. Our emotions, our stress, anxiety, all of those tend to creep up in our bodies, and it really has a tremendous. It can have a tremendous impact on our physical being. Our emotions and mental can impact what's going on physically in our body. So we want to do anything we can to reduce that anxiety. Now, it's not the easiest thing to do. Meditation, some mindfulness stress reduction is really good too. Being more mindful of what we're doing, even mindful of when we're eating. Be Take the time out to just de-stress. We want to really calm the body. And lymphatic drainage therapy helps to calm the body. And guess what? When we calm the body, it can actually help us to heal ourselves. So we work on, the nervous system. We reduce that fight or flight symptoms or syndrome that we have, whether it's a happy stress or a scary stress, it's still a stress on the body. So you really have to find a balance. And it is all about balance. Um, Easier said than done, but we need to get our lives in balance. And we're going through every day, and we're so preoccupied with what's going on because of the diagnosis or the treatment, and it's part of our lives. And I have to say, one thing that I found to help me was not fighting it anymore. I had to make a decision in order to reduce that anxiety, how I was going to handle it. I decided to embrace it. And I mean, I didn't like looking at my arm getting big. I didn't like looking at my breast just swollen. So I embraced it, and I embraced the work I had to do. It's not the easiest thing, but it can be done. And when you make it part of your lifestyle, it just is so much easier to address it. But it's nice if we can get a handle on it beforehand. Um, So managing that stress is really, really important. There are other things you can do. There's something called a vibration plate, and all it is it's a little metal plate that you stand on, and it vibrates the whole body. And that is an excellent thing, especially to move the lymphatics in the breast tissue. And because when you move, our lymphatic system is all throughout our system. It's throughout every part of our body. And when we're moving, the muscles help to move that lymphatic system. And that's all great. But unfortunately, in our breast tissue, there's nothing there to move it. We might get a little kick from the heart. We can take deep breaths, breathing in and holding it for a little bit and expanding that lungs and expanding into that retromammary space. And we can get that movement, but it's just not enough. That's why we really encourage a very good lymphatic breast massage. And even if you've had a mastectomy or something like that, you can still have breast massage or a chest massage and just keep moving that fluid because we don't want it to get stagnant. And when we have surgery that cuts the lymphatic system and the tissue, we need to kind of regenerate and move that lymphatic system. And we can redirect it too, if necessary, to move it away from those concentrated areas and move it over and through those incisions. It will depend. A lot of things will impact that depending on how much scar tissue is there, but we try to work through that as well. And that's also impacted by the lymphatic drainage therapy. A little bit more about what we do. I just have a list of some services that we provide. We provide a breast health education. A lot of times I see women who have had a thermogram, or sometimes they've had a diagnosis, or they're just they've had history of cancer in their family. And what we try to do is teach them how to prevent it if they can. So we talk about nutrition. We talk about what's going on in their tissue. I teach people to really learn what's in their tissue. So a doctor may come and do a breast massage, and I think within a minute they're done. For me, I think we need a little bit more time than that. So and that's why I do what I do. I feel women need to be empowered to learn more about it. I mean, I just had my regular exam with my gynecologist the other day, and I think I talked to him for a few minutes, and then he was gone. Then I talked to him. I kept him in the room talking to him a little bit more, and then he charted. Yeah, I had to spend an extra 10 minutes with her. So we don't spend a lot of time with them. The docs don't spend a lot of time with us, unfortunately. They can't. It's just the nature of the game there. So that's where I come in, I think, and what I try to teach people. There's more you can do to learn about what's going on in your breast, and you can get ahead of the game. I am thoroughly convinced if I was doing what I'm doing now, I may not have been diagnosed. I really do believe that. But I look at it as almost a blessing right now, and I'm glad I'm here. I'm glad I'm here to talk to you. I'm glad I'm here to share this information with so many people. And that's what I really try to do. I also work with people who have had lymphedema on scar tissue, actually even any kind of post-operative procedures, whether it be cosmetic or, heck, you have a cesarean birth or something like that. We can help you with that too. We do breast cupping. Now, breast cupping is a little different than what you might be familiar with. It's not anything where it leaves marks, but it's cupping and that fits right over the breast, and it kind of pulls a little bit and releases and through its suction. And what that does is help to get fluid flowing in the area. So it really saturates the area with blood, and as it pulls and releases to help take the toxins and waste out of the tissue and move it into the bloodstream to get processed and through the kidneys and liver and so forth. We also take care of new mommies with who have mastitis. So we have some other tools to help pull that out too. We do health and wellness coaching. All of the clients that come to see me, we will have some coaching sessions, and I think I'm hoping it. I know it's helpful. We talk about nutrition. We talk about just things that they can do to reduce their anxiety and all of that. And that's what we've been doing I've been doing for the past 4 years, 4.5 years now. And and I just think this is so invaluable information. And I really hope that you find this helpful as well. Now, all right, that's the end of this presentation. However, I know that you might have some questions, and I'm so happy to answer them if you need any clarification on some of the information that I went through. I know it was a lot to go through at one time, but I think it's helpful information. So let me know if you have any questions.
Thank you, Claire, so much for this presentation today. I will go ahead and stop recording so we can answer any of those questions.